Abby Bray was a healthy little girl in Tampa, Florida, when 1 month after her 9th birthday, troubling symptoms.
She said, "It feels like there's knives in my bones."
After her pediatrician ran some tests, a phone call to her parents, Laura and Mike.
"There's a bed waiting for her at St. Joe's Pediatric Oncology Unit. Pack a bag, plan to stay. Get there immediately."
Abby had acute lymphoblastic leukemia. To save her life, she would need a rigorous regimen of chemotherapy, including a drug called Erwinaze. But then,
A few months into treatment, we were told, "Okay, you have to go home. You can't get this medicine today. It's a shortage."
Abby wanted answers.
She knew she needed to take all of her medicine. Like, what happens now? Does this mean I die?
That's when Laura sprung into action, assembling a group of friends called Abby's Angels. She made a list of children's hospitals in the U.S., and everyone pitched in to make phone calls.
Just a few hours later, we had gone through it, and we found some medicines. One of my friends made the call.
Over the next 9 months, Laura needed to step in again to get 2 other drugs the hospital couldn't find because of shortages.
Never once did I contemplate that I would also have to be navigating the largest global supply chain in the world in order to keep her alive.
Laura is a business school professor, and so she had the skills to do that. But she knew other families weren't so fortunate.
It really haunted me.
A study last year showing that of 19 essential agents to treat cancer in children, 74% had experienced one or more shortages since 2016. Pediatric oncologist Dr. Yoram Ungaru says there are several reasons for the shortages, including:
when you look at the drugs overwhelmingly that are in short supply, they are not your blockbuster drugs. They are not the drugs that pharmaceutical companies generate huge profits from.
So Laura took matters into her own hands, forming Angels for Change, raising about $500,000, she says, in less than 3 years, to pay a small drug manufacturer to make essential drugs and offer them up to any hospital that needs them.
Since May, they've been accessed more than 500,000 times for patients all over the U.S.,
earning praise from experts.
You just look at what her organization has accomplished in the past few years, I think it speaks for itself. And there's something to say about that adage, hell hath no fury like an angry mama bear.
This mama bear navigating the global supply chain for children all over the country with cancer. Elizabeth Cohen, CNN, reporting.